Good afternoon, Miss Kamisha. How are you doing today?
I'm okay, feeling, anxious. It's a lot going on in my life right now.
Wow. I'm sorry that there's a lot going on in your life right now. Would you like to start by letting me know what's causing you those stress?
Oh my gosh. My job, I just got this new promotion. It's really demanding. I have to meet certain deadlines. My relationship with my significant other has been really kind of hard, and we've just been arguing a lot lately, and I'm just like,
Okay. Yeah, that sounds like you have a lot on your plate. So let's break it down some. How is your anxiety doing specifically? Are you experiencing symptoms, any triggers? Do you notice anything?
so I have trouble sleeping, and I've been having like this tightness in my chest. It's I don't know. It's just been really overwhelming. I'm getting very irritable. I just don't know.
Wow, yeah, that is a lot. I'm so sorry to hear that. And it's understandable that these stressors can take a lot on you. So, let's explore some of the coping strategies that we can um, work on to help you manage your anxiety. Have you tried any relaxation techniques or mindfulness exercise?
Deep breathing, I've tried, but I just can't seem to focus. With me being overwhelmed, I just
Right. Well, that's okay. In addition to that, we can also explore other techniques. For example, we can explore cognitive behavior strategies to address any negative thought patterns that could contribute to your anxiety.
it sounds helpful.
Okay. Now let's talk about setting some realistic expectation and boundaries to reduce some of those external stressors. For example, with your job, is there any way you can renegotiate some of those deadlines to elevate some of the stresses that you are going through?
I haven't really considered that, but I can explore those kind of options. Yeah.
Absolutely. Taking small steps to create a more manageable workload is always a significant makes always good for our sorry, it's significant in our work life. So we'll also work on improving communication and conflict resolution skill to address the strength that it's putting on your relationship.
Yes, that would be great because I really want to like work things out with my partner. Like, oh my gosh.
That's good to hear. Fantastic. So let's schedule our next session to dive in deeper into those strategies and continue to work towards reducing your anxiety and improve your overall well-being.
That sounds really good. So like, do I go see, like, start taking medication or seeing a therapist?
Do you if we can explore that option, if you think you need to see a psychiatrist, we can explore that option and see if you need to get on some medication. But sometimes working on reducing the stress level can kind of solve those problems. So let's start there and
Okay.
then see what and go from there.
Okay, and how long is this going to be, like, this whole process?
It all depends on your progress. So we'll start. Let's say I want to see you maybe in about 4 weeks and see
Okay.
how you're doing, and then if you're doing better, then we can increase it to maybe 8 weeks. But if you're not, then we can start talking about maybe taking some medication, maybe to kind of help you calm, especially with the sleeping. You need to sleep to be able to function well.
Yes, because, oh my gosh, like, this here is killing me, and I'm just so, like,
It's a
I'm
lot.
tired.
It's a lot.
But I'll be willing to take those
Okay,
options.
sounds good. Okay, so I'm looking forward to see you next time.
Yes, I'm very excited. I'm very glad I came
That's
to
good.
see you, so I can't wait.
It was nice meeting you.
It was
Mr.
nice
Misha.
meeting you too. Thank
You're
you.
welcome. Okay, Miss Kamisha. So tell me, are there any family history of mental illness? Um,
Mm, my mom has anxiety,
okay.
but there's not really any that I can think of. Like,
Okay. Any history of have you ever been treated for mental illness, or have you ever been admitted to any behavioral facility for anything that you know of?
no, this is my first time actually like coming forth.
Okay. Okay. Are you on any medication?
I'm supposed to be on Zoloft, but I don't take it. It's just whatever.
How does it make you feel when you take it?
Oh my goodness, that's probably why I don't take it. It makes me feel like a zombie, and I just don't like the way it makes my body feel. It feels like I'm not
Okay. Have you
present.
have you talked to your doctor, maybe changing that to something? Maybe your body's a little too sensitive to that type of medication, so maybe they can try another one.
I don't really like taking medicine, so I haven't
understand.
really talked to her about it. I just stopped taking it.
Okay.
I know that's kind of bad, but
Right.
hmm.
Okay. So that's something we can also take a look at medication wise. Any suicidal thoughts?
No
That's good.
suicidal thoughts.
Okay. Any history of sexual, physical, or any other type of abuse? Okay, that's good.
Nope, just me and my significant other. We just argue, but it's no physical or
Okay.
mental or anything.
So that's in line with my next question. You feel safe at home?
Yeah, I do.
Okay, that's good. And so you are not taking any. You are on medication, the Zoloft, but you don't take it on a regular basis. Are you taking any other medication, any other medical issues like diabetes, high blood pressure, any thyroid issues?
High blood pressure. I was taking hydrochlorothiazide. The low dose of it, but I stopped taking that too. I'm just not a medicine taker.
You're not a medicine. You don't like medication. It's understandable. It's understandable. So, with the stress level that you're going through, with the anxiety, the Zoloft seems it's one of the medication that has been prescribed to a lot of patients. But if it doesn't work well with you, we can also try something called sertraline. That's another one that people a lot of my patients have been prescribed by the psychiatrist, and they seems to be happy with it. So maybe we can refer you to a specialist and see if that will be an option. Would you be interested in that?
Yeah, I mean, it's not gonna hurt to try, I guess.
Okay.
Yeah.
Okay. Any other symptoms other than anxiety that you've experienced?
No, just the stress and the anxiety and
Okay.
trying to figure out my relationship. I really want to save it. I don't want to, I know that that's kind of like hurting my relationship.
Right,
So,
right. Have you talked to your significant other about any of these issues?
as of lately, no, because I try to avoid them. We get, we get into an argument every time
Right.
so.
Okay, it's understandable. We definitely need to work on that and try to fix some of that issues. Okay, well, Miss Kamisha, it was really nice having you here in the office, and I hope next time when we meet again, we'll have a set plan of what to do next.
Okay, that sounds really good. Thank you.
You're welcome.
Thanks.
You're welcome.